Riedel thyroiditis is another type of the thyroiditis that you can say that it is a rare type of thyroiditis and rarely seen in the patient, and mostly it is different from other type of thyroiditis in context that it cause the fibrosis and it spread to other tissues, other nearby tissues of the thyroid gland. Now, discussing more about the Riedel thyroiditis basically is more common in the females like other types of the thyroiditis. If I forgot to mention that the Hashimoto's thyroiditis and the subacute thyroiditis, both are common in the females and both are common in the age between the 40 and 60 years of age. Like our patient, Risha, who was suffering from the Hashimoto's thyroiditis, she was also with the age between the 40 and 60 years old. So this type of disease is also common in the female. Mostly the thyroid gland related diseases are more common in the female because the female undergo more hormonal changes, like in case of the menstruation and puberty changes, and also during the pregnancy and menopause. All of these changes can trigger the hormonal changes and may cause the disease like the thyroiditis, hyperthyroidism, and hypothyroidism. So female are more prone to this, but if the disease occur in the male, it will be more severe as compared to the female. So talking about the Riedel thyroiditis specifically, it occurs in females commonly, and the ratio between females to male is 3:1. So you can see that the female are three times more suffered than the males in case of the Riedel's thyroiditis. Here now, this is the only type of thyroiditis that is going to affect the tissues other than the thyroid gland. All the rest of the types that we discussed were just limited to the thyroid gland only, but now the fibrosis and the destruction of the cell will distribute to other part of the body, will spread mostly to the mediastinum. The structures of the mediastinum and retroperitoneal parts, all of these will also be affected by the Riedel's thyroiditis. And also, if we discuss about the presence of the filtrate and the inflammatory cells, they will also disperse or spread to other parts of the body. Like if you examine a patient who is suffering from the Riedel's thyroiditis, you can observe the infiltrate in the muscles, and also you can see that the infiltrate get accumulated along the sides of the nodules, and the lymph nodes in the body, from where you can identify that this is the Riedel's thyroiditis. Now moving on to clinical feature. In most of the cases, the disease does not cause any symptoms. It is asymptomatic. But when it causes symptoms, it causes gradual onset of the painless goiter. There is the formation of the goiter that is gradual and that is painless. And then there is the hard thyroid mass that can be seen, and there can be the fibrosing lesion. As I told you that there will be the fibrosis of the cell, and the cells will be destroyed, and also the thyroid gland and the tissue will become very hard, and it will look like just a hard mass there. And also the size will increase and a goiter will appear that is painless. So these are some symptoms of the Riedel's thyroiditis. Now, talking about the morphology of Riedel's thyroiditis. As I told you that the tissues that are surrounding the thyroid gland and other part of the body are also going to be affected. The infiltrate is seen like here. You can appreciate different type of the cells, T cells, inflammatory mediators, and there can be the B cells, and lymphocytes can also be seen in this infiltrate, and this can spread to different muscles and nodules as well. The fibrosis will be prominent here, and this fibrosis can be seen in the thyroid gland and in all other parts of the body that are affected. And these fibrosing lesions are basically the prominent feature that will distinguish this Riedel's thyroiditis from other types of the thyroiditis. So this was about something about the Riedel thyroiditis. That is a rare type of the thyroiditis, and in that sense that it is going to spread in other parts of the body, and it is going to cause fibrosis of the different cells and also the thyroid gland. So this was all about the thyroiditis. We discussed that thyroiditis is the inflammation of thyroid gland that is caused by various reasons, autoimmune reasons, genetic causes, and infection, and some bacteria and viruses can also cause thyroiditis. Depending upon these causes, we classified the thyroiditis into different types, like the Hashimoto's, that is the chronic form of the disease, acute thyroiditis, subacute thyroiditis, Riedel thyroiditis, and also like the drug-induced thyroiditis, and that is associated with the radiological treatment. Then we discuss about all of these types one by one. Now, moving toward the case that we just discussed in the start of our lecture, we discussed that a patient whose age is between the 40 to 60 years of age and suffering from the symptoms that are like depression and the pain in the neck and fatigue, and then we also discussed about its physical examination and the laboratory examination that show altered level of the T3 and T4 hormone, and also antibodies were present there. Now, all of these features, just look upon the different types of the thyroiditis. What type of the thyroiditis holds all of these features that Richa is presenting? As far as we have discussed, the Richa is suffering from Hashimoto's thyroiditis because all the symptoms of the patient are related to the Hashimoto's thyroiditis, and the diagnostic criteria is also fulfilled. Like there is the presence of autoimmune antibodies, and also there is the alteration in the T3 and T4 hormone level that is indicating that patient is suffering from Hashimoto's thyroiditis. So the most prominent or the most promising clinical features are the fever and the fatigue and the malaise and the depression that can be seen in the patient. So this was all about this lecture. Thanks for watching sqadia.com.